How does a hormonal IUD prevent pregnancy? Imagine a tiny device inside your uterus that works quietly to prevent pregnancy without you needing to do anything daily. That's what a hormonal intrauterine device, or IUD, does. It releases a small amount of a synthetic hormone called progestin, usually levonorgestrel, directly into the uterus. This hormone acts in several ways to make pregnancy unlikely. First, progestin thickens the cervical mucus, which is the natural fluid in your cervix. When this mucus becomes dense, it forms a strong barrier that blocks sperm from entering the uterus. This physical barrier is one of the main ways the IUD prevents fertilization. Second, the hormone thins the lining of the uterus, called the endometrium. A thinner lining makes it less welcoming for a fertilized egg to implant and grow. Without proper implantation, pregnancy cannot occur. Third, progestin can influence the fallopian tubes, which are the pathways eggs travel from the ovaries to the uterus. It can slow down or alter the muscular contractions of these tubes, making it harder for an egg to reach the uterus. This reduces the chance of fertilization happening altogether. Fourth, the environment within the uterus and fallopian tubes becomes less hospitable to sperm, decreasing their chances of surviving long enough to fertilize an egg. Most women using a hormonal IUD continue to ovulate normally, although in some cases, it may partially suppress ovulation. The device's effects are mainly localized within the uterus, so systemic hormone levels stay low, which often results in fewer hormonal side effects compared to other hormonal methods. It's important to remember that while hormonal IUDs are over 99% effective at preventing pregnancy, they do not protect against sexually transmitted infections. Using barrier methods like condoms alongside the IUD can help reduce the risk of STDs. Many users also experience lighter periods or even no periods at all, which can be a helpful benefit. In summary, a hormonal IUD prevents pregnancy by creating multiple barriers to fertilization and implantation. It thickens cervical mucus, thins the uterine lining, alters fallopian tube movement, and makes the environment less friendly for sperm. These combined effects make it a highly reliable, long-lasting choice for contraception. If you're considering an IUD, it's always best to discuss with a healthcare professional to find the best option for your reproductive health and needs.